Mr. President, we solicited questions from the public to direct to you and had a Facebook audience vote on which one they wanted to be asked. And the winner was a fellow named Ken Fletcher of Albany, Oregon. And his question is, why is there so much focus on reducing entitlement programs as opposed to the military or other forms of spending?
Well, for the same reason Willie Sutton robbed banks. That's where the money is. But I think you do have a point. Let's talk about it. Non-defense discretionary spending is only about 13% of the budget. And there are savings to be had there. The GAO just did a big study, which I'm sure a lot of you have seen, which determines, for example, all the different programs. I think there are like 19 different adult literacy programs. That's just a small example. But there's a few $billion there. It's not a significant amount as against the size of this deficit, but it is a significant amount in terms of reinvestment in our future. I personally, if it were me, I personally would favor looking at that study, implementing all the things as we did under Al Gore's Reinventing Government plan, which saved $136 billion over a 10-year period. And I'd like to see that money reinvested in non-defense discretionary spending that's future-oriented, in green technologies and bringing back manufacturing and biotechnology, in a reauthorization and expansion of the new market initiatives, which rewards investments in relatively poor areas in America. That's what I think should be done there. There is money there, but it's not dramatic. Then on defense, I agree with you, sir, but defense is 4% of our gross domestic product. Medical spending is 17.2%, and almost half of that is government insurance of some kind or another. So there's just a lot more money in health care. Also, on Social Security, it was meant to be self-sustaining, and with the retirement of the baby boomers, it won't be anymore. But I think there are progressive and fair and decent ways to reform Social Security, and I think Medicare and Medicaid cannot produce savings in good conscience unless they're part of a comprehensive plan to bring down the rate of inflation in medical costs. You simply can't have medical costs going up at 3 times the rate of inflation every year. And you can't justify America spending 17.2%, Canada being the next highest rich country at 10.5%, Germany and France always ranked first and second for overall outcomes at 10%, and America ranking somewhere in the high 20s to 30 in the overall effectiveness of our health system. Everybody just assumes we can't do anything about this. But if you break down where we're out of whack with the rest of the world, you see that the biggest category is rooted in paying for a procedure instead of for health care, and having no comparative studies of cost and outcomes. Pennsylvania, I think, is still the only state in the country that requires all the hospitals to file what are charged for various procedures and attempts to determine the comparative results. And what they find every year is there's literally no connection between what's charged and what results are getting. So that's the biggest. The second biggest, by far, are the administrative costs and profit margins related to the way we finance health care, which is one of the things that is also a source of problems between the Republicans and Democrats, because the Republicans want to put more people in the insurance system and claim that individual consumers will have bargaining power. It's just not true. In 2009, in the depth of the recession and before the passage of the health care bill, so it was not available to blame. The insurance companies raised rates in 2010 and this year, claiming, I'm sorry, I know we don't have cost raises, but we've got to have these huge reserves for when all this terrible Obamacare comes in. In 2009, they didn't have it to blame. Their profits went up 26%. 5.5 million people lost their insurance. 3 million went on Medicaid and ballooned the deficits of the federal and state governments. So we have to look at that. You simply can't have an unregulated de facto monopoly. In most states, 1 or 2 companies have 80% of the market. So, and you can't have 30% administrative cost in our system, which is what it is, if you count the insurance companies, the hospitals, the other providers, the employers, and the individually insured, all their paperwork costs, nobody else is over 19. That's $215 billion a year, the $1 trillion difference. We can't have that. Now, there are other things. We have too many readmissions and medical errors. If we had uniform sterilization procedures, we'd save a fortune and save a lot of lives. The VA hospital, alas, a government entity, the VA hospital network is the first hospital network in the country, apparently, to uniformly apply these procedures to try to reduce infections, readmissions, and costs associated with it. That's a problem. The American people are about 15% of the problem. Our lifestyle choices, particularly related to obesity and exploding diabetes, are a result of about $150 billion of this. And then according to the McKinsey study, we pay about $66 billion more for medicine than we would if we lived in any other country, including the pharmaceutical producers in other countries.
And yet, Mr. President, even supporters of the new health care law, of which you know the American public is still grievously split over, even they say that the new health care law may not have done enough to address all of the things you're talking about to bring health care costs down.
Well, I agree with that. But Gwen, my position, you know, when I was out there making appearances in the last campaign, I said, look, this law is not perfect, but this is a huge, complex issue. What we should do is continue to improve it, not repeal it. The argument for repeal, I can give you in a second. I know this is a complicated issue, and we haven't talked about malpractice reform or the end-of-life care, which is a big part of this, or other things. But the real reason there was a big push to repeal instead of to reform is one little line in that health care law which said, if you're insured in a big plan, 85% of your premium now has to go to your health care, not profits or promotion. If you're in a small plan, 80%. And oh my goodness, the insurance companies acted like it was the end of the world. But in Minnesota, where more and more plans are pay for health care, not pay for procedure, they're already at 91% statewide. And if you take Blue Cross Blue Shield in North Carolina, for example, is already at 87%. It's not an unreasonable requirement, and I believe it's going to hold. These things will really bring down health care costs compared to our competitors over the next decade, but we've got to do much more of them. And basically, there ought to be a national system like Pennsylvania's that has real reports on a regular basis about cost and results. So it will create, that really will give consumers power. That will give insurers who want to bring down cost power. And it will have a huge impact if we do it.
Can I get back to the defense spending question just for a moment? Because you said that it is not the problem, that health care spending is the bigger problem.
I think there are savings there. I'm sorry. I think we have to include defense. Let's look at where we are. And this gentleman's question, why is there so much focus? Most people in Congress believe that we need a strong defense, and we do. But increasingly, our national security is affected by climate change, resource depletion, the so-called soft power conflicts of, you know, religious and other political conflicts. So national security is going to have a broader meaning here, protecting the borders and all that. I think that some of these weapon systems have to be eliminated. Now that Congress eliminated, unbelievably, we had the Joint Strike Fighter, which I spent a lot of your money trying to develop, and which I believe in. That is, why should every service have to have its own fighter plane? It was a good idea. So when they saved money on that, then they turned around and said, oh, well, an engine might fall off. Let's give a whole other company a contract to produce another engine. It was not a good thing. They got rid of it finally. But the Marine Corps also asked to eliminate a fighting vehicle that is being produced. It's a $5 billion article. Congress refused to do that. We have 11 carrier battle groups. The Chinese Navy has been dramatically modernizing. They have these great diesel-powered submarines that go deep, fast, and quiet, but they only have one aircraft carrier battle group. Do we need 11? Now, keep in mind, every time you do that, somebody in America loses a job, but in the end, if the money is properly reinvested, you get more jobs. That's what happened when we had the base closing in my first term. We just use those resources to build a different kind of economy. I think there's no question that defense will have to be a bigger part of this than it's been so far.
You just touched on an important point, which is there are economic trade-offs at a time when the economy is still struggling to rebound. You didn't have to deal with the struggling economy as you were attempting to do these big things. How does this administration deal with the economic trade-off? For instance, if you decide to increase corporate taxes, there's a strong argument to be made that you're also slowing down the economy by doing that. If you lose a job when you cancel a weapons program, if you cancel home owners' aid assistance, no matter how you interpret what the actual effect is, the message you're sending is that you're taking jobs away, taking support away at a time when we're not back on our feet yet.
Well, I've already said, you know, what I would do is to combine. First, I think the timing's important. I think most of this stuff should bite next year, not this year.
Because?
Because the economy's too weak.
Not because of the election.
No, to heck with the election. No, the election's next year. Some of this stuff will start before the election. No, it should be driven by economics. Secondly, I think there should be a real effort this year to take the GAO study and other things that we know to cut as much peripheral spending in the non-defense discretionary budget as we can and reinvest it in things that will create jobs, mostly manufacturing and green technology and incentives to invest in other areas. Thirdly, I said, let me say this again, I think our corporate tax rates can be lowered in a way that will be an incentive to invest in America and will raise as much or more money if we won't lower the rates before we get as much or more money out of tax expenditure eliminations. It's not just individuals that get tax expenditures, corporations do too. So this corporate rate looks high, but the bizarre thing is some people pay it because all their operations are in America and they don't have the access to deductions, and others pay next to nothing. So I think we can bring the rate down, but we have to bring the tax expenditures down. Then I think on the individual side, again, relating to creating jobs, we may want to move away altogether from a system that taxes labor at middle and lower levels and income and tax things more. You could get rid of the payroll tax altogether, which is a big deterrent to creating jobs, if you imposed a progressive VAT tax, or if you had a tax on pollution, so-called externalities, and then create just as much money and invest more of it. My problem is, with the current dilemma we're in now, is we need to get rid of this debt, but we need to do it in a way that brings back investment. What happened when I passed the deficit reduction is we got a big drop in interest rates, a big spike in the bond prices, a big increase in private investment. 92% of our jobs were private sector jobs. Right now, we don't have a strategy to get there or an easy path, even though the banks have over $2 trillion in cash and only $160 billion, according to the last thing I saw, in bad mortgages. So whatever we do, whatever complex of things we do, should be designed to trigger more bank lending and more investment from corporate surpluses in the United States, so that we'll get enough economic activity that will really boost revenues if you make these other changes.